morning, everybody. I want to thank everybody for getting together. I love it when I get to start Monday mornings in my hometown. So, and first, I want to thank the mayor for doing a good job in my city I love living in. So,
well, thank you. You are one of my constituents. So thank you.
And you do a good job. Well, the goal that we've done roundtables around the state, and the goal of this has been to, one, understand if there are any unmet needs. Thanks to the support of the legislature, Representative Pasadomo has been very supportive. We have allocated $26.2 million of the state resources through the authority that I have to allocate resources in an emergency, but the legislature has been extremely supportive. We have been providing more resources to our Department of Health, to mosquito control. It's run through our state health department, which works perfectly well with our county health departments. And so of that $26.2 million, which we've set aside, we have allocated $23 million of it. We will allocate more dollars if we need to help our mosquito control or Department of Health, and we're doing it county by county around the state. I think we've allocated funds in 28 or 29 counties now. Where we are from a state standpoint is we have 42 cases where we believe there were local transmission. We only have 2 locations in the state to date where we've had local transmission. The first was in the Wynwood area, which is north of downtown Miami. That was about a little over, I think, probably 5 weeks ago now. We have been able, through education, through very good work at our mosquito control in Miami-Dade, through our county health department, we've now been able to reduce the size of that in half. So that is about now, it started out about 1 square mile, now it's down to a half square mile. A week ago, Friday, we announced our second area. That was Miami Beach, where we have 5 cases. 2 local and 3 were from out of state, 1 from Texas, 1 from Taiwan, and 1 from New York. Where we believe there's local transmission, and it's about a 1.5 square mile area between 8th Street and 28th Street, with the Atlantic on the east side and the Intercoastal on the west side. So when we find a new case where we believe there might be local transmission, we work through our county health departments and work through our local mosquito control and do a very aggressive outreach and very aggressive mosquito control. And by the way, both Collier and Lee do an extremely good job, 1, working together, and 2, they do a great job in mosquito control. And we've even brought in, our Department of Health has brought in some additional support to help Miami-Dade County from some of the counties, including Lee. So they've done a great job. We have 2 areas in the state, 1 in Pinellas, 1 in Palm Beach County, where we're doing investigations to see if there was local transmission. We've had cases like this in Palm Beach, Broward, and Dade before, where we had an individual, but we found no local transmission. So it's not, other than that one individual, there was no other cases. We started this back in February when we had our first travel-related case, and and let me make sure, we have 42 cases of non-travel related, not necessarily local transmission. I didn't say they were exactly the right way. We have a little under 600 cases of travel-related Zika, where somebody's come from another country and come here. But we started in February. We started focusing on doing the roundtables, getting information out, making sure our mosquito control, our county health departments have been working together, and we've been doing this since, and they are working very well together. We have tested 4,172 people so far. We have active test kits of a little over 6,125 active test kits right now on hand at our county health departments, and 7,200 antibody test kits. I will be traveling to Washington, D.C. Next Tuesday, first day Congress is back in session. As you know, they went on recess without passing any legislation, which was disappointing. We have been asking, we've had requests into the federal government through the CDC. They just recently gave us the Zika antibody test kits we've been asking for. We want to make sure that we can continue to test everybody we need to. We have asked for more lab support. We've asked for Zika prevention kits for our pregnant women. We haven't received those yet. We have offered everybody pregnant or state the opportunity to get an assessment and a test at our county health departments, to do everything we can to make everybody feel comfortable that they're knowledgeable of what's going on. We've been very aggressive at getting information out that's accurate and timely around the state. We have a very good Surgeon General, Dr. Celeste Phillips, and we have very good county health departments. So that's an overview of what we're doing. We will allocate more dollars if we need to. We're going to ask Washington for more support. It's disappointing that they're not doing more, but we're going to continue to put up the resources we need to. So why don't we go around? I think the first the health departments wanted to talk about what they're doing.
Currently, the health departments are engaging.
I'm sorry, can we go around and introduce everybody so everybody knows who
Sorry,
everybody is?
Angela Schwartzman. I'm the health officer for Lee County.
Bill Barnett, Mayor of the City of Naples.
Janelle Modis, Tourism Office, Collier County.
Al Flores, Acting Administrator of Collier County Health Department.
Cindy Woolley, Communications, Collier Mosquito Control District.
Patrick Lynn, Collier Mosquito Control District.
Chad Tom Westford.
Yeah.
Hickey Moran, Naples Fire Department.
Leo Ochs, Collier County Manager.
Ms. Freeman, Naples Daily News.
Kathleen Passidomo, Florida House of Representatives. This is my district.
Jesse Curtin, Congressman Kirk Clausen's office.
Jennifer Roth, the lead epidemiologist for the Health Department in Lee County. Lisa LeBlanc, Hutchins Airport Operations, Lee County Port Authority.
Ted Health, Fire Chief of the Lee County Board of Authority.
Chad Rosenstein, Director of Government Affairs for the County Board.
Kathleen Moore, Department of Health, Collier, Sebastian Clarence.
Mohammed Abbasi, Department of Health and Collier.
Jennifer Gomez, Department of Health in Collier County. Andrew McKinney, Department of Health, Collier County.
Jason Sheffield, Congressman Plazma's office.
I'm sorry, go ahead.
Okay, no problem. I was excited about all that we're doing. Right now, the health department is actively working to educate clients, residents to make sure that we're removing standing water from residences. That is probably the single largest thing that we can ask everyone to participate in. These mosquitoes breed in very small amounts of water, so a bottle cap full of water is enough for reproduction of this mosquito. So the Department of Health has done an excellent job in engaging the school system with the Spill the Water campaign. As Governor Scott previously mentioned, we are doing testing for all pregnant women free of charge to kind of put the minds at ease and waylay any fears that they may have. We're working actively with obstetrics, gynecologists to deliver the latest science as it becomes available to us. This is a rapidly changing issue. This is morphing very quickly, and we're learning more every day. So communication has been paramount, and I'm very proud of the way the department has communicated with the community and local community agencies.
So let me introduce Commissioner Penny Taylor in the back.
Thank you.
By the way, what was just said is what we found. I mean, the biggest thing we can all do is get rid of standing water. It's like, if you could say it every day. If we don't have standing water, we're not going to get, we're not going to have the same issue. And so, and what we've seen around where we've seen issues, there's been a lot of standing water. I mean, it's the biggest issue we can deal with now. We got to use bug repellent. We've got to have no standing water, and then if you have concerns, wear protective clothing, wear long sleeves, pants. And make sure if you have any concerns at all, if you're pregnant, come to the county health department. So do you want to talk about what Collier's doing?
Yes, sir. We've been very active in the Zika event. We've done a lot of outreach. Matter of fact, I'm going to let our event coordinator, Kathleen, speak to specifics that we've done so far.
Specifically, we're doing identical to Lee County and all of our DOH departments throughout the state. Very extensive education and outreach. We're actually cross-training not only our personnel, but also volunteers and county employees as well, certain employees to participate in what we call door-to-door outreach. So if we should have a local case then we can immediately descend on that community and make sure we educate people to the best of our ability. We also are offering free testing for pregnant women and modeling at the Naples campuses, and continue extensive outreach. I'm working very closely with our mosquito control district since February. So we're lucky, like you said, we have a robust surveillance and treatment program.
The other thing we're seeing around the state is some of the cities and counties, their code enforcement is really going out and being very aggressive at getting rid of standing water. But what we are seeing is there's very good coordination among everybody, and that's what's going on. So do you all want to talk about, anybody else want to talk from the health departments? Anybody else want to add anything?
Jennifer, do you want to talk a little bit about kind of the process as far as EPI's perspective when we get a new case?
Sure, yeah, similar to what the Collier County was saying, when we get a case of, a suspect case of Zika, we work very closely with the clinicians in the hospitals that are are concerned about the case, who are trying to diagnose this. So we work with them, and we also interview the patient themselves to try to gather as much information as possible, because we want to know, is this travel related? Are we concerned if it's a local transmission? So we get all of the travel information, we get all of any additional labs that we might need, and then we facilitate any coordination that needs to go from the hospital to the state lab. So the state lab will test everybody that they think could be a case of Zika. So we will coordinate that testing with the hospital. It goes to the state lab, and then they do a follow-up. And in the meantime, what we're doing with the patient while we're waiting for the results to come back is counseling them about travel. If they're a pregnant woman, making sure that they're using good mosquito protection. Again, making sure that they're avoiding getting mosquito bites while they're here, because we don't want them to contribute to any local transmission. And at the end of the day, if the labs come back, we work very closely with the clinicians to help treat that patient in case they have any severe complications. Or if they're a pregnant woman, then they'll go on a registry, and we'll monitor them throughout their pregnancy to see if they have any ill health effects from the virus.
The way to think about it is our job is really to protect pregnant women. I mean, if none of us get bitten by a mosquito that has Zika, then we're going to protect every pregnant woman, and that's the real risk here, is that that we impact the development of a child. I mean, that's most of the issue. Anybody else?
And then those results are then utilized before the positive result is even obtained. Those results are provided to the local mosquito control district, and then they can begin spraying and taking measures to knock down that mosquito population before we even have that result. So lessens the risk before we've even got confirmation, very proactive. So as Governor Scott said, it's a very communications key, and that synergy between all of the agencies doing their parts.
You talk about mosquito control.
Indeed, our relationship with the health department is enormously helpful in meeting the mission of reducing the populations of Aedes aegypti in the area. We have seen populations of Aedes aegypti that are large wherever there's a high density of people, actually. Excuse me. And we have specialized traps that we use. Once we get word of a suspected case, we will begin at least 10 days of surveillance, intense surveillance in the area. And this parallels our other mosquito control program as well. So it's very busy times. We're on the phone with the health department daily and communicating back and forth. And we are aggressively treating for not only the pest mosquitoes, but the Aedes aegypti. We're hoping for a cool winter.
And other thing, you're very. If somebody calls you, you're very proactive, responding. If a business calls you or a home calls you, you're very responsive. If somebody says they have a concern, you respond very quickly.
We do. We have multiple means by which our citizenry can report to us. We have a website, of course, a mobile application, and also the old-fashioned telephone. You can pick up and call us. And we have several. We have one specialist who does surveillance in our Zika program, but we also have our other inspectors as well who can come out.
Is there anybody else from mosquito control that would like to add? Okay. Wait, Kathleen, did you want to?
I'd like to sort of anecdotally, the standing water, to piggyback on what you said, Governor. I've spent the last couple of months meeting with constituents in their homes throughout the district, and there's been a lot of people that are out of town. We have a lot of snowbirds here, and what I've noticed, there's a lot of decorative urns and pots and fountains that are full of green water, standing water, and what I've said, interestingly enough, to the neighbors that are home, go next door and empty the pots out because there's a lot of standing water. And it's just sort of a simple thing that you can do in your neighborhood. And I also want to thank the governor. You know, when this first came up, we were completely unaware of the issue, and it was our governor, and I want to thank him on behalf of the constituents that came to the legislature very early before this was in the news. And because of your proactive stance, have been able to galvanize the healthcare community, and I think it'll be very beneficial for our citizens. I just want everybody to know how much we appreciate what you've been doing for us.
Mayor.
Thank you, Governor. I'll echo a little bit of what Kathleen Castello said. I think the biggest thing for us in the city of Naples, we have residents that they're, I wouldn't say they're fearful, but they don't, the communication has to be really good, and after this meeting especially, let them know, standing water, do whatever you need to do, and the communication lines, I think, are the most important for them, and we will continue to make sure that they are aware. And thank you again, Governor.
So one thing people don't realize is that we've had other mosquito-borne viruses, chikungunya, dengue fever, and we've done, I don't know if you want to talk about that, we've done a very good job of stopping local transmission because of the relationship and the hard work of the county health departments and the mosquito control.
Chikungunya and dengue are both additional mosquito-borne viruses that Zika is detrimental to the fetus. That's where you're seeing a lot of that the microcephaly, the publicity with the children with the small heads. But dengue and chikungunya are equally and more concerning in some populations. You become very, very ill, and that's not just infants, that's the population at large. And this area has been extremely proactive in keeping those mosquito populations knocked down so that we have minimal local transmission of those viruses as well. But this is more of the same. All of our efforts towards Zika are only going to aid in those other viruses as well.
But we've done a good job of stopping local transmission in those areas. So if everybody works together, this is all doable. This is all doable. The difference with this is that we have the risk of the developing child.
Yes, absolutely.
That's why all have to be a participant. Commissioner, do you want to add anything?
No, I'm just I'm just very impressed with what I've heard today, and I think that you, sir, are doing as much as you possibly can given what we know today. And I'm thinking that our mayor has this wonderful system of communicating to the residents of the city via a telephone call. And I'm thinking myself, as we're listening, this is going out to my email list of what to do, which is what Representative Casadamo was talking about. It's on the ground. We need to help. We need to start it. And again, I'm very pleased to hear the coordination and level of awareness.
Particularly, you want to explain that these are mosquitoes both in your house and in your yard. You can't have standing water in either one. It impacts both.
That's right. These mosquitoes are evolutionarily fit for humans, and they prefer a human blood meal, and they live where people live, and they keep the same hours that people keep. So if it seems like a lot to ask,
Sounds like a horror show.
to really eliminate standing water is enormously important, and I know it's a pain, but you have to continue to do so until it dries out. In addition, we have almost every home here has air conditioning and screens, which are very, very helpful as well. But yeah, they live where we live.
But some areas don't have the same amount of screens that we have, and so we have to use screens.
Indeed.
But this is in your house too. These mosquitoes are in your house. They're not just in your yard. They're in your house, so you can't have standing water in your house either. It's the exact same thing. So, Does anybody from the police or fire, does anybody want to add anything?
Ours is mainly a support role, but you brought up a great point with the code enforcement. I'm sure that's something to go back with the mayor and discuss. That's a good concept for us to address when we go back.
Yeah, where they really focused on it was down in Miami, both in the Wynwood area and now over Miami Beach. Because, we have to get, it'd be nice to get it before, but we have to get active, make sure we don't have this.
We just continue to get information out to the community to make sure they're aware through our website. So that's pretty much what we're doing, and we want to play that supportive role as well.
And that's the same in Lee County. We take our lead from the health department, follow whatever the direction is.
Good. All right.
We look forward to meeting with you next week in DC.
Yep, I'll see you next week. All right. Anybody else? Do you have anything you want to add?
Just from the tourism perspective, we posted the day that it went national with the local transmitted case in Miami, of course, the national news. We put informational posting on the homepage of our website, a tourism website for Collier County, which is paradisecoast.com. So that's there, and it's updated almost daily with information, and really just trying to clarify the information and put it into layman's terms for people to easily understand. We're fortunate in this time of year, over 50% of our visitors are Floridians. And so they're really more aware of the situation, and they're gonna take their last summer vacation. So that's very good news for everybody in the tourism community. As far as international, there's a lot of publicity. For instance, we just heard from our German office that it's all over the news in Germany, but people are very confused. So we're doing active outreach to make sure that our international offices are understanding of what the actual situation is. And we're also beginning educational outreach with easy to understand messaging for all of our hotel and restaurant partners.
To put in perspective, we've had 42 cases of non-travel related, and we've got 1/2 square mile north of downtown Miami, 1.5 square mile in Miami Beach. It takes 15 hours to get from Key West to Pensacola. So,
right.
So I mean, it's a very small. Now it's important that we all stay active. And by the way, the Department of Health provides an update every day on their website of of basically all the information we're putting out is put up there every day. Anybody else have anything else they want to address?
Just from the airport's perspective, we're certainly appreciative of all the coordination that's going on throughout the two counties. So thank you very much.
And by the way, the airports started back in probably March. The airport started informing people as they came through the airport. Some of them were doing digital signs, some of them doing just like I know Miami-Dade had these big signs put up. The Miami airport did. So the airports have been very good. So have the ports. We have 15 seaports, and they've been very active. And then over the weekend, I think it started with Disney. They're giving out bug repellent to all their guests, and I think SeaWorld and Universal are going to be doing the same thing. So the people are being very active. So we keep everybody informed and make everybody feel comfortable that we're doing everything possible. No standing water. Yes.
Yes, no standing water goes with this perhaps pending wet weather. I mean, what can we expect with, this might be a question for mosquito control too, just pesticides being washed out, washed away?
The big thing is no standing water. As soon as it rains, get rid of it.
Right.
Everything you can do, get rid of it.
Can you define the question a little bit?
Yeah, should people be concerned with lots of rain coming in potentially and all of the previous efforts being washed out? Is that something that's possible?
It is possible. I'm thinking it's a fairly complex answer to a complex question. The answer is certainly the simplest answer is to continue to get rid of the water. But it takes several days for a life cycle, a week probably. So even after 3 days, it's still fine to go out and rinse bromeliads or bird baths, etc. The larvicide that we can use to control the larvae can give us a short-acting control, and it is possible in a small container that that larvicide could be washed out. So, once again, back to, the community has much more power than they think, or what they might realize in terms of eliminating the source.
All right, thanks, everybody. By the way, we have a list of sort of all the things we've done, and we've got a map of the 2 areas in Miami that are impacted. We also have the Department of Health's website and also local telephone numbers that anybody might want to use.
Governor, I'm sorry, or perhaps ma'am, I just want to apologize if you put out this information already, but at the present time, are there any known cases or suspected cases, travel or non-travel in the area, in the Naples area?
Travel related, yes. We have no local transmission in this area at this time.
How many travel related?
6 in Collier.
And do we have 8 in Lee?
Thank you.
All right, thanks, everybody.